Good afternoon, ladies and gentlemen. My name is Henry. I am here from the Kent and Victor Chamber of Commerce. Welcome to Business Bites. I am absolutely delighted to be joined by Dr. Victoria Beccari from the Kent Family Medical, who's going to be delivering this presentation on working well and living well, obviously super important in the modern working environment. Now, we will have an option for questions and answers at the end. Victoria is soon going to be sharing a slide, which will have a QR code to Slido, where you're able to submit your questions anonymously. I will also be putting the link to slido.com and the number for the specific Q&As relevant to this event in the chat as well, so you will have that. So can I just finally ask that those of you who have joined today, just rename yourself to your full name, just so we know who you are for registration purposes. So that is enough from me. I'm now going to pass over to Victoria. Over to you.
Thanks, Henry. Hello, good afternoon, everyone. So today I will be talking a little bit about occupational health. So a bit about me. I am a GP and an occupational health doctor, which is great. It means I have lots of fun in my working life. I get to see patients on a day-to-day basis, just in terms of their normal health issues. And then I get to delve in a bit deeper on the occupational health side of things and see how their health interacts with their work. I am very and more than happy for people to ask questions as we go along if need be. But I have got a Slido link here so that if anybody wants to join the Slido and ask questions anonymously, we can at the end, but you can also just ask questions at the end as well. That's absolutely fine. So the point of today really is I don't want to teach anyone or speak to a matter that people are fairly well informed on. Most people have an understanding of what occupational health is. It's basically how health impacts your work and how work impacts your health. And the role of an occupational health doctor really is to try to be that middle person, right? So not being too leaning towards the employer, not being too leaning towards the employee. We do only take referrals from employers, so an employee can't self-refer, so to speak, to occupational health. So sometimes that can give an impression that there's a little bit of imbalance, but our role is to try to maintain sort of this impartial position and be able to just give advice to both the employee and the employer about how they can navigate whatever health issue may be going on around work or whatever work issue might be impacting their health. And the aim of it really is to make sure that we keep people in the workplace, that when people are in the workplace, that they're happy, they're healthy, and they're thriving and doing well. We often see the close relationship between somebody working and somebody's health. And so we know how important that is in the workplace. So that's why I'm here, because that's what I wanted to talk to you about. Now, the basis of what I really want to talk about today is two aspects. One is the occupational health referral, and the other one is about the appointment. And shortly, we will have a bit of a mock occupational health appointment. So you can kind of see what happens when we actually do these appointments, when your referrals go off or when someone goes off to occupational health, what to expect from the person at the other end, or what kind of it might happen in an appointment. So I've put a little slide here just to talk about occupational health, because actually, whilst we can recognise it's quite an important area of work, it's an important aspect to have for any business. There are still there's still a bad rep sometimes, in that sometimes people get their reports back from the occupational health clinician and just feel that this is not helpful, not useful. I didn't really need to send them off, and what was the point of this, and that kind of thing. And so the referrals that are made really are to try to get the specifics of what information you need to know. So I've seen quite a wide spectrum. Will have on one end the employers who already know absolutely everything about their employees' health conditions. They have listed every condition, all their medication, every sickness absence they've taken in incredible detail. And they know all of their issues and how it impacts their work. And sometimes you think, oh, so what do you need me for? It seems like you've got all the information at hand, but obviously there's an interpretation of some of these health conditions that does need sometimes some sort of clinical knowledge and understanding of each condition to be able to help navigate. And then you've got the other end. You've got the referrals that perhaps don't have much information, if any at all. And that can be for a few reasons. It can be because the employee doesn't feel comfortable sharing or talking about their own personal health with their employer, which is completely fine, and they're not really at liberty to do so. Or it could just be that the employer perhaps is not quite sure what we need to get from occupational health, but knows that that's probably what needs to happen now. So sometimes there's an expectation that, what I'd like to know from occupational health is what's going on with them, can they come back to work, and are they okay to do their job? But sometimes the questions that are asked or posed to occupational health don't always reflect that. So it's about just getting that balance right. And like I said, it's on all parts. We've got the employer, the employee, and we've also got occupational health. And sometimes reports can have medical jargon in them, or sometimes it can take too long to get a report. And I think understanding the process of how we come to write these reports and what's involved in them can sometimes help demystify some of these challenges. So that's what I'm hoping to get across today. So when we then look at what makes a really good management referral, I think that the main thing is actually the fourth bullet point here is what is the question? Having a clear question. So when writing an occupational health report, it will probably be a little bit of a background, and at the end, a little bit of a summary. But in the middle, the main body of the occupational health report will be an answer to the questions that the employer has asked. So if the employer asks two questions, one of them is, are they fit for work, and when can they come back to work? But actually, I end up speaking to the employee, and this happens more times than you could imagine. They're already at work. They have been working, and so one of those questions is now redundant, and the other question is, well, if you've been working, what now is the problem? So it's really looking at the specifics of what are the workplace issues. This person has a health condition, but what does that mean for them at work? What are their symptoms, and how does that impact their ability to perform and do well in their job? And it can be really helpful to get an idea of what the employer has already tried, what's worked, what hasn't worked, what are the problems? Is it that they're absent from work and they're sick all the time and they're coming in, once or twice a week, but not for the rest of the week? Or is it actually that they're in, but performance-wise, you're noticing some difficulties, and actually they're not performing the way that they were previously, or there's been a change, or maybe that they've never really been able to perform well because of a health condition, or that's what they cite to be the problem. The other thing is as well, having like this general fit for work stamp. It's almost as if occupational health say you're fit to work, then we're good to go. But actually, unfortunately, it's not that linear. So asking if someone is fit for work, it's sort of providing some additional context behind that. What does fit for work mean for this particular role? We speak to people from all kinds of different jobs. And actually, if somebody works in an office, but I don't know, has severe migraines, and they're looking at the screen all day, that might be a bit of a challenge for them. But if someone has severe migraines, but actually they don't do any screen-facing work, and maybe they do some outdoor work, and actually they feel better outside, then that not so much. So it's all about looking at the context for which someone is fit for work and being able to frame the referral in that way. We aren't expecting, when we receive the referrals, that you actually have every detail of every appointment and all the health conditions and medications. That's sort of our responsibility to get all that information down. But just having an idea of what issues you're facing at work with this person, so that we can do the rest and ask the clinical questions and ask the medical bits. That's really where we come in. So having those referrals as clear as possible for that context is really helpful. So what happens in an occupational health appointment? And the reason why I wanted to go through this is because sometimes we can get referrals, and it's clear that perhaps maybe the person who's written the referral doesn't know what's about to happen in the appointment. And I say that because, for example, employees have absolutely every right. It's advice from the Faculty of Occupational Medicine. They have every right to see a copy of their occupational health report. And it can be very tricky to have an occupational health appointment and write up a report to answer all these questions without going through the referral itself with the employee. So I tend to start a lot of my conversations, well, this is what I've been told by your employer. And sometimes the way that the referrals are written perhaps give me the impression that maybe they didn't think anybody would see this. So it's sort of understanding that, whenever we're talking to people about their own health issues, that there has to be a degree of transparency that we as occupational health need to have with the employees to be able to effectively answer the questions and to be able to get context. And also, mostly just to make sure that we're all on the same page. I really like working in occupational health. I think it's a very rewarding career, but you can imagine that there are some times where the employer and the employee are on opposite ends of the spectrum in terms of what they believe is what's happening and what's going on. So being able to establish at the beginning, this is what I've been told, and making sure that the employee is also of that understanding is quite important. And then, so in terms of just the general process, again, I don't want to go through things that people may already know, but we always have to get verbal consent, even if they've turned up physically for the appointment and are in front of me. They're sitting there and ready to go for the appointment. You could assume that yes, they've given consent. They're here. Of course they have, but actually. It does happen where people don't really understand why they're there, or they don't really understand what being there means. So when I take consent, I'll explain that, your employer has made a referral, go through a bit of the referral with them and explain that I have to write a report to send back to your employer because they've asked some questions. And then I also, in sort of the introductory piece about consent, talk about confidentiality, because I'm still a doctor and doctor-patient confidentiality still does apply in occupational health. So if there are any aspects of the conversation that they don't feel they want those specific details shared with their employer, then I'm not at liberty to share unless I feel that they might be a harm to themselves or to their employers. Even then, there's a way that these things can be written to try to get across that message. But it's important that the employee feels comfortable sharing whatever it is going on, and can speak freely to help me be able to answer the questions properly and write up the report. Then we'll discuss their symptoms, how it impacts work, what possible adjustments can be advised, and the way that the report is going to be framed, and I'm hoping we'll sort of get an idea of like how I might come about you know, explaining and discussing these things with the employees will be around the person's job, right? So it's not, if they've been, for example, the example I always give to everyone when we talk about confidentiality is about mood. If someone's been really low and really depressed, and it's because they're having, let's say, a relationship breakdown and they're really struggling, I don't need to put in the report that this person has had a big argument with their partner and now they've moved out, and that's not necessary. The personal details of what's going on with them is not really the point. It's just I might say something like their low mood due to personal circumstances is impacting their ability to focus or concentrate at work, that kind of a thing. And like mentioned before, all employees will have access to preview the report. And sometimes this can be where the delay is, because sometimes the employee might receive the report and feel uncomfortable about sharing it with their employer for whatever reason. Sometimes they refuse to give consent to have the report released, or they might just take a little bit longer to come back and say, yes, I'm happy for you to share with my employer. So it can really depend, but we always do give them the option. Some people say, I don't need to see it, you can just go ahead and send it. And in those instances, it tends to work out pretty well for everyone. But I know that in my appointments, I will always try to give the employee an idea of what I'll be writing in the report, because that leads to a lot less contention, a lot less problems. People have an idea when they read the report and it's what we've discussed, they're more happy to then consent and release it. So I just wanted to talk briefly about the Equality Act, because the Equality Act tends to be one of the most sort of recurring questions that we get in occupational health. So the Equality Act is basically an act that determines whether somebody is considered as disabled. And so sometimes I get a question well, not sometimes, but fairly often we get questions such as, does this person, in the opinion of occupational health, fall under the Equality Act? And if they are to, what we can do is offer our opinion whether or not someone is defined as having a disability under the Equality Act is a legal determination. So we can offer an opinion to say, yes, it's likely they are, or I don't think they might be in this case. But there are four main factors that sort of determine this. And that's whether or not they have a physical or mental impairment. That's long term. Long term is defined as 12 months. It has a substantial effect on their ability to perform their activities of daily living. So can they, can they take care of themselves? Can they get into the shower? Can they, take the dog for a walk, do some grocery shopping, that kind of thing? Their normal day-to-day activities, can they still function that way? There are some conditions like cancer, epilepsy that are automatically under the Equality Act. And all of this means really is that the employer then has a due responsibility to make reasonable adjustments for this person in the workplace. Right, so one of my colleagues, Nicole, is on this call with us, and she's going to simulate basically what it's like when an employee comes for an occupational health appointment, so that you can just get an idea of, in practice, what actually happens in the room and what are the outputs of that. So we'll try to be quick. We did practice earlier and we were going on for a little while, so we'll try and be brief in our assessment of it. So this will be the management referral that I've received. So the management referral says that Nicole is is a customer service worker. She's had 3 months of stress type symptoms, sleep issues, headaches, and poor focus. Recently off sick and anxious about returning. And then I have 3 questions here that they've asked me to answer. Is she fit for work? Do we need any adjustments to get her back to work? And will she provide reliable service in the future? So Nicole, if you'd be happy to join me, we can start the occupational health appointment now. So hello, my name's Dr. Bakari, and you've been referred to occupational health because your employer has some questions about your health and how it relates to your work. Can you tell me a bit about your job and what you do?
Yeah, I work in the control room. It's really busy, stressful. Sorry for the police, and I work night shifts, and it's a high pressure, stressful environment. It's constantly on the go.
Okay, all right. And how many hours a week do you work?
I do 18 hours, but it's split over my 3 shifts.
Okay, all right. And so your employer's made this referral. They've told me that you've been having some stress symptoms, sleep issues, headaches, poor focus, and that kind of thing, and that you've been off sick. Is that right?
Yes,
Okay. And do you understand today that when we have this chat, the aim is really that I write a report back to your employer to answer some questions they have about your health and work? Are you happy with that?
yeah.
Yeah, and would you like to see a copy of the report? Well, I'll send you a copy anyway, but it's very much up to you whether or not you'd like to see it before I send it to your employer, or whether or not you're happy for it to go off at the same time. Do you have a preference?
I'd like to see it. That's
Yeah,
okay.
beforehand, that's absolutely fine. And once you've seen it, just let me know when you're happy for us to send it off, or if you have any questions or issues with the report, okay?
Yeah.
So perhaps you could start by telling me what happened just before you went off on sick leave, because I don't get the indication here that your employer knows why you're off. What was going on?
I was just struggling more and more with the pressure at work. I found it very overwhelming, to the point where I couldn't manage, and I didn't really want to go in. And when I was there, it was a constant state of anxiety, and I was struggling.
Okay, all right. I'm sorry to hear that. And so you've been off for the last few weeks, is it?
Yes.
As a result, okay. And what kind of symptoms have you been experiencing?
Well, when I was at work, I was on edge constantly, where I felt like my insides were shaking and every part of my body just wanted to leave the room. I didn't want to be there. It was making me extremely anxious when I was there. So it's like a physical feeling, but also low moods, and it was affecting my home life, and the anxiety of knowing I had to go to work tomorrow meant I couldn't sleep.
Mhm. Okay. And how is this affecting your attendance or your performance at work, or did it?
Um, it didn't perfect. I felt like I was struggling, but obviously I tried to carry on as normal. I've not been made aware that it was affecting my performance.
Okay, okay. And what about attendance? Have you been off sick for this type of issue before?
Not before this occasion, no.
Okay. And have you been to see your doctor in this time? Have you had any therapy, any medication, anything at all?
I went to see my doctor because I needed to be signed off. But he didn't offer me any medication or anything.
Okay. And is there a plan to see them again?
I think I might go back if it persists.
Yeah.
They did say to do that if it didn't help having the time off.
Okay. And how do you feel about going back to work now?
Anxious and worried about it. I feel like it's just going to be a vicious cycle where it doesn't get any better.
Mm. And if we could put some things in place before you go back to work to try to make that transition a bit easier, do you think that would help?
Yeah, definitely.
So some things that come to mind. So my role really is to see if there's anything we can do to help get you back into the workplace, but in a way that is safe and comfortable for you. So for example, if you had a return to work meeting, so you didn't just sort of rock up to work on a Monday morning, but you had a return to work meeting and where you were able to discuss some of the work related stresses that you've been having and maybe look at going back on a phased return. So you wouldn't necessarily go back to your full working shift, but just slowly and gradually whilst we have a chance to implement some changes. How does that sound?
It sounds good. It'd be nice to be listened to and have something implemented like that. That'd be good.
Okay, well, why don't we say then, so if we go through some of the questions that I've been asked for the report. So I've been asked whether or not you're fit to work, and it sounds like you're keen. It sounds like you'd like to go back to work, but obviously because of some of the barriers that have happened, it just makes you feel a little bit cautious about it. So how about we say that you are fit for work, but perhaps you need a few adjustments, such as a phased return to work, a return to work meeting to plan what that might look like, and maybe a meeting as well with your line manager or whoever it might be to really just have a look at what your workload is like, what demands are being placed on you, and ways that they can look at reducing your stress whilst you're at work. Does that sound okay?
Yeah.
Yeah.
Yeah, it sounds good.
And the last question I've been asked is whether or not you'd provide reliable service in the future. It's a bit tricky to say, but it sounds like you've not been off sick for this reason before. And perhaps if we do implement some of these adjustments and recommendations, it might prevent you from being off sick in the future. So I'll probably answer that question in that kind of way. Does that sound all right?
Yeah.
Yeah, great. So I'll write up this report, and if you have any problems with it, please just let me know. I won't change anything. That's my opinion based on what we've discussed today. But if there are any factual changes, any factual inaccuracies, then I'm happy to correct those. Okay.
Yeah.
All right. Thanks, Nicole. So I mean, that is a very very, very brief way of doing an occupational health appointment. They usually last anywhere between 45 minutes to an hour, because we get into the nitty gritty, we get into, you know, the history of it, we get into all the aspects and tasks that are required in the day and that kind of a thing to be able to make very specific adjustments. So that was definitely not a very accurate representation, but just an idea of the kinds of questions that we ask and how we kind of go about things. So at the end there, I mentioned about a planning meeting with Nicole when she returns to work, because we know that mental health is such a significant cause of sickness absence in the workplace. And there's a helpful tool called the Stress Risk Assessment that HSC advise, and there are 6 areas to look at it. So the first thing is to say, when most people are familiar with a risk assessment, you know, for example, if you work in a workshop and you've got cables on the floor, you can see that a hazard there is the cables on the floor and you need to tuck it away so you don't trip over. That's quite a clear and obvious thing. But when it comes to mental health, sometimes it doesn't always seem that way. So HSC have provided 6 key areas where you can perhaps go through with the employee and look at what is likely to cause them to have work-related stress and how can we mitigate them. So things like demands, revising or reviewing the workload, or the pace at which they do their work. Relationships, is there anyone in the office that's making it really difficult for them to do their job the way that they'd be able to or comfortable to? Or things like role. Some people have a job description, but actually their day-to-day doesn't reflect that. And sometimes they're not really sure what they're meant to be doing, and that can cause stress. So this is something that occupational health can advise on and say, why don't you look at doing a stress risk assessment with this framework? But we can't lead this process. We can't do the details of it. That's still the responsibility of the employer, mostly because we're not there day to day, and we don't always know what would be a reasonable adjustment or facilitation to make in that regards. But that was just an example. So because I really want to leave some time for questions, and I think we're coming towards the end of our 30-minute talk. Occupational health, the thing that I really wanted to just get across today is it's about how people's health is impacting their work or vice versa, not about the clinical stuff. You can leave that with us. That's really what we're here for, to be able to work out how that can feed into their workplace and what isn't possible. Anything or implementations have already been done for employees is so helpful for us to know, because then we don't have to go around and make the same recommendations twice, or perhaps we can say, actually, you recommended this, but that's not helpful for X, Y, Z reason. Referring early is always really good. I've had so many instances where people are coming in for an issue that's been going on for a year or two, and actually it would have been really helpful to get some information from them a lot sooner and make some adjustments and recommendations early to prevent problems and more sickness absences. And then, as I mentioned before, just having really clear expectations, really clear questions on what information it is you're hoping to get from occupational health. Right, so any questions? So I think we have some questions already here on the Slido, which I'm happy to answer, but I am happy if anybody wanted to unmute and ask any questions, I can absolutely leave room for that now and then come back to the Slido questions. Are there any questions from the room? No? Okay, then how about we go through these Slido questions? So the first one, how do you deal with an employee who doesn't want to give consent to releasing an occupational health report? So that happens frequently. It happens frequently if it's not made clear to the employee what's going to be in the report. Every doctor, every clinician has their different way and style of doing occupational health. My preference really is to try to make it as clear as possible to the employee what's going to be in the report. And if there have been any contentions previously, that can sometimes make people less reluctant to want to share that report. Sometimes they feel it might mean they lose their job or that kind of a thing. So what I explain to the employee, either at the point where they've decided not to give consent or prior to, in the appointment itself, is that, look, if you don't give consent for this report, then your manager is going to be able to take management decisions in the absence of this report, meaning that they've tried to help and get some support and get some understanding. But if you refuse, they're going to be able to make these decisions in the absence of any input from occupational health. So really, it's in everyone's best interest that the report is released. And then if that's not sufficient, having a follow-up conversation. What are the issues with the report? What aspects don't you want to be shared? Can we rewrite this in a way that makes you feel comfortable is also an alternative option. So there is room. It doesn't have to be all or nothing. And the next question, has the shift to remote and hybrid working impacted occupational health? And what can be put in place to ensure remote staff are being looked after well? Yeah, it absolutely has, in the sense that a lot of the referrals that I've been getting recently is this person wants to work from home for a health issue, and we don't think they need to work from home, which is a tricky one to navigate, because then it is complex. It is, do you really need to work from home, or is it just nicer to work from home? So yes, there have definitely that's impacted the types of referrals that we've been seeing. And actually, lots of people, for example, will say that for their mental health and well-being, they prefer to work at home. That's a really tricky line to skate, really, because actually, is that really a reasonable adjustment? Like, can you physically get into the office, and are you fine when you get into the office, and can you do your job well in the office? So I think that's one aspect of it. But then in terms of looking after remote staff, that's another thing as well, because we do see I guess this notion that remote staff sort of get forgotten about because they're at home. And so things that people can put into place quite simply, for example, is having desktop station assessments at home. Lots of people are like trying to work from their kitchen tables or from their bedrooms or just other environments. They don't always have the space and the setup to have a desk and have a laptop rise, just making sure that the same type of condition that they may be working in the office can also be done remotely as well. And having regular wellbeing check-ins, I think this is something that would be great if it was implemented everywhere, just on an ongoing basis. Even though the team is working remotely, it's still possible to communicate and have discussions and check in on wellbeing. And I think sometimes I've seen some instances where organizations and employers will try to say, well, you're working on your own, so you must be feeling really low in your mood, and you can't build any team capacity because you're working away. But actually, in practice, that's not how people feel. They like the flexibility sometimes that remote working offers. And if they could just have some more support even if it is remotely, just having conversations, team conversations, well-being checks, then that would be really helpful. So it would just be a case of considering the remote staff as if they are in the office, and just considering them and not forgetting about them because they're at home and not in the office. So that's how I'd answer that. Do we have any other questions?
Hi, I was just going to ask, how long would you recommend leaving it until going to occupational health?
Well, I think it depends on the scenario. I would always say if occupational health is a question, it might be a good time to make the referral. Because if you're thinking, something is brewing, it might be easier to make the referral then, and then you can always have follow-ups later. So, for example, I often see people who I can give an example of a recent one. I've seen someone who has had a recent diagnosis of a chronic condition, quite a life impacting one, and still really in the early stages of the condition. But the employer, not he's not necessarily symptomatic, but his employer doesn't actually really know how to navigate this for his particular job role because he works in quite a specific environment that means he needs to be able to, handle tools and machinery and things like that. And they're not a bit sure what this condition means. So actually at this stage, I'm able to say, well, this is what this means at this stage. And these are the things that perhaps you might need to look at putting into place. But why don't we see him again in 6 months' time when medication has been started, once he's had a chance to see how his symptoms play out, once we've been able to put some risk assessments and sort of test those and see how well they're doing, and we can check in later once we see how things progress. It's a dynamic thing. Most people, that's the nature of health, isn't it? You don't just other than the few things like chest infections and hay fever season that lasts a few months. Most chronic conditions will be rolling, and most people's health conditions will roll over, and sometimes that means that they need reviews. Sometimes that means just having some check-in points. So sooner rather than later really is the recommendation. As soon as you think that there's a query for occupational health, I think that would probably be a good time.
Perfect, fantastic. Linda, thank you very much for the question. Victoria, thank you for facilitating and hosting that Q&A. I would just like to conclude now, as that has brought us pretty nicely to about 1:30. So first of all, can I just thank everyone who came along today and has listened to this presentation. Victoria, obviously a massive thank you for today. What a super informative presentation, and I really liked the sort of more physical, accurate representation of what the referral service looks like. I thought that was really excellent, and I think a lot of people will take a lot away from that, just to know that that's what's in place behind their referrals. So thank you all again for attending. I've been Henry from the Kent and Victor Chamber of Commerce, and have a fantastic rest of your day. Thank you very much.